Continue with the class. So in the previous video I have seen that I have dealt with paraplegia. So in this video we'll study about quadriplegia. So what is quadriplegia now? So quadriplegia, it is also known as tetraplegia. Okay, quadriplegia, it is also known as tetraplegia. So in this mainly it affects all the four limbs. Okay, it affects all the four limbs. So quadriplegia, it is also known as tetraplegia. So in this usually it affects all the four limbs. Okay, it affects all the four limbs. So in this mainly the paralysis usually occurs from the, like in this usually what happen, they will be having paralysis below the neck. Okay, they will be having paralysis below the neck, which makes them completely unable to move. Okay, which will in this usually they will be unable to move. Okay, completely they will be unable to move. So this form of paralysis, okay, this form of paralysis mainly occurs when there is spinal cord injury, especially to the cervical region. Okay, so this type of paralysis occurs when there is spinal cord injury, especially to the cervical region, that is from C1 to C7. Okay, from C1 to C7. So what is this quadriplegia? Quadriplegia, it is also called as tetraplegia. It mainly affects all the four limbs. In this type of paralysis, it affects usually below the neck, which makes it completely unable to move. So in this type of paralysis, it mainly it is occurring due to the spinal cord injury, especially to the cervical region, that is C1 to C7. Okay, especially to the cervical region C1 to C7. And this is what is quadriplegia. Quadriplegia, it is also called as tetraplegia. It mainly affects all the four limbs. It mainly, this paralysis usually occurs below the neck level, and the person is unable to move completely. So this usually occurs when there is injury to the spinal cord, especially cervical region, from C1 to C7. So that is usually about this quadriplegia. So next is causes. So causes is mainly fully depends upon the spinal cord injury. Okay, mainly it is caused due to spinal cord injury. So spinal cord injuries, it can be due to the car accidents, any fall, any violent attack, assault, or due to sports and recreational injury. So that is usually this. So cause of this quadriplegia is mainly due to spinal cord injuries, and this is spinal cord injury occurs due to any car accidents, any fall, violent attack, or any violent attack. So that is usually there, are sports and recreational injury. So that is usually about this cause of quadriplegia. Okay, that is usually about this cause of quadriplegia. So next is symptoms. So when we talk about the symptoms, they will be having loss of sensation at the site of injury. Okay, they will be having loss of sensation at the site of injury. Then they will be having chronic pain. Their sexual function will be decreased. Okay, their sexual function will be decreased. Their bowel and bladder movements will be, functions will be disturbed. And secondary infection occurs because they are unable to move, due to which bed sore and skin infections can occur. Respiratory problems develop. Okay, respiratory problems develop, which might lead to death due to this spinal cord injury. Okay, respiratory problems occur due to this, they will be leading to death due to this spinal cord injuries. And also they will be having, I have told you, that difficulty to bladder thing. They will be having urinary incontinence, or they will be having frequently urinary tract infection. Okay, they will be having urinary incontinence, or they will be having frequently urinary tract infection, like urinary incontinence will be there, or they will be having frequently urinary tract infection. So that is usually also there. And also they will be having, so that is spasticity. Okay, so that is they will be having spasticity. Spasticity is nothing but they will be having sudden involuntary movements of muscles, that is uncontrolled movements of the muscles. Okay, they will be having uncontrolled movements. This is especially in the areas, affected areas. Okay, this is especially seen in the affected areas. Okay, so this is usually about the symptoms of quadriplegia. So what are the symptoms of quadriplegia? Chronic pain, loss of sensation at the affected site, spasticity will be there, that is uncontrolled movements will be seen. Then respiratory symptoms, problems can be seen. Due to this is the reason for the death of the person due to spinal cord injuries. Like they'll be having bladder dysfunctions, that is they'll be having regular urinary incontinence, or they'll be having frequently urinary tract infection will be there. Sexual functions will be decreased. Then they'll be developing secondary infections. Secondary infections they are developing mainly due to they are unable to move. So they develop bed sore, or any bed sore or skin infections. Then they'll be having changes in the mood. Okay, they'll be having changes in the mood, that is anxiety and depression. Okay, they'll be having anxiety and depression. So that is usually about the symptoms. Diagnosis is the same, like blood test, myelography, CT scan of brain and spinal cord, X-ray of brain and spinal cord. So it is usually about this, and lumbar puncture test. So this is diagnosis similar to that of the both quadriplegia, hemiplegia and paraplegia. Blood test, lumbar puncture test, CT scan of brain and CT scan and MRI scan of brain and spinal cord, X-ray of brain and spinal cord, and myelography. So that is usually about this diagnostic evaluation. So next is management. So when we talk about this management, so what is done? So in this management, mainly we go with surgeries. That is, brain and spinal cord surgery will be done to mainly to reduce bleeding, or if there is any obstructions. Okay, surgeries are performed mainly to brain and spinal cord, where it is mainly done to reduce bleeding, or if there is any obstruction, that will be removed. And next is usually what happen, medications will be given. Medications are mainly given for blood, that for antibiotics will be given, as well as blood thinners will also be given. Okay, blood thinners also will be given. So that is, medications will be given, like antibiotics will be given, or blood thinners will also be given, like heparin and ceftriaxone will be given. Then other things like therapies they go with, physical therapy, occupational therapy, and then exercise therapy, as well as psychotherapy. So physical therapy, exercise therapy, everything they usually give. An important thing, they go with speech and language therapy. Okay, there's speech and language therapy, so that they'll be assist for them to talk. Okay, so they'll be able to speak again. Okay, they'll be able to speak again. So this is about this management. So management, we go with surgeries which is performed on brain and spinal cord, mainly to reduce bleeding, and also if there is any obstruction, they will be removing that. Then speech and language therapy, physical therapy, psychotherapy, exercise therapy, and occupational therapy. Medications, they go with antibiotics and blood thinner. So this is about this quadriplegia. So what is quadriplegia? Quadriplegia, where all the 4 limbs will be affected. This is mainly due to the spinal cord injury, especially this cervical region from C1 to C7. So in today's class, we have studied about this other different spinal cord injuries like hemiplegia, paraplegia, and quadriplegia. So what is hemiplegia? Hemiplegia, where they will be affecting one side of the body, either one arm or one leg. Paraplegia, where they will be affect below the waist level, their functions will be stopped below the waist level. And in quadriplegia, all the 4 limbs will be affected. Okay, in quadriplegia, all the 4 limbs will be affected. So this is about the spinal cord injuries that is usually seen in case of individuals, that is hemiplegia, paraplegia, and quadriplegia. Hemiplegia, again I am telling, it is like affecting one side of the body, either one arm or one leg. Paraplegia, it affects below the waist level, and quadriplegia affects 4 limbs also. So hemiplegia studies usually about all the 3, it is mainly caused due to spinal cord injuries. Okay, all the 3 it is mainly caused due to spinal cord injuries. So spinal cord injuries, how it is occurring, like accident, assault, or any hit on the head, or in case of any sports and recreational injuries. So that is usually cause of this, all the things. And symptoms, it is usually said loss of sensation will be there at the area of the injuries. And like in paraplegia and hemiplegia, you can see like secondary infections develop because they will not be able to move. And then sexual functions will be decreased, bowel and bladder function will be decreased. And in all the 3, they will be having depression, their mood will be changing, like in hemiplegia, paraplegia, as well as in quadriplegia, their mood will be changing. And in case of quadriplegia, you can see respiratory changes occurs, and this is the reason for the death due to spinal cord injuries. So management is similar, like antibiotics will be given, blood thinners will be given to reduce blood clot or something. So that is usually there. And next is usually what happens, so that is usually given, that is also usually done. And next, physical therapy, psychotherapy, and occupational therapy, speech and language therapy is usually done. So this is about this hemiplegia, quadriplegia, and paraplegia. Please check out the videos and go through with the class. Thank you.